have community support groups, mayor and council stakeholder discussion. And with us, we have Ms. Teresa Searcy, Director of Case Management with Community Action Council, Ms. Jeannie Asbury, Executive Director with REACH. We have Mr. Dave Schuster, President and CEO with Horizon Goodwill Industries. And then we have Ms. Melissa Dash, did I say that wrong? Melissa Dash, Division Director of Rehabilitation and Recovery with Sheppard Pratt. Would you guys please join us at the table? Look at that, they have chairs already waiting on you. And if you want to move the chair, Jeannie. Sorry, I'm like, Jeannie, move the chair.
Housing and Case Management.
Hi, everybody.
Well, thank you all for coming and responding to the invite. Again, this is the fourth opportunity we've had for the mayor and council to hear from stakeholders related to various aspects of community issues that have been advertised out in the airwaves and social media. And this opportunity is for you all to deal directly with some of the individuals that have been spoken about. Just a chance for each of you to explain what your roles are within the community, and then of course a chance for the council to ask questions and get clarification, that kind of thing. So Jeannie, if you want to start.
Great. So thank you very much for this opportunity to be here. So REACH is...
I'm sorry, could you introduce yourself for the record? I'm
Yes.
sorry.
We know you.
We know you, but for the record, sorry.
So Jeannie Asbury, the Executive Director of REACH of Washington County. And I brought with me the expert with 20 years.
Your boss.
Our Director of Housing and Case Management, Jill Zamosny.
Thank you.
Okay. So REACH is a nonprofit that's been in existence for 34 years. From its inception, it's a collaboration. It started with several houses of faith came together and realized there's a problem we need to address. And so it started with like a 24-hour hotline call, and then eventually led to a day program that's still in existence, our drop-in center. So that's somewhere that people can go to get out of the weather, hot or cold. During the non-shelter season, the homeless can take a shower and do laundry. That's where you can get your mail. Without a physical address, how do you get your real ID card, which has to be mailed now? How do you get that housing letter and various important documents? So that is something that is provided year-round. Everything but the cold weather shelter is year-round. So then the shelter came about. So the shelter's been 20-something years, and different houses of faith come together. I say that because most of them are churches. However, the synagogue and the mosques are also involved. So they all come together to provide volunteers. It takes 15 to 20 every single night to run the shelter. That variation is if you have, we all know those 5 ladies that don't need, or people that don't need anyone in their hair in the kitchen, versus you can have up to 10, whether it's youth, different groups, businesses all come together. They provide dinner every night. REACH does not provide the dinner. So that is truly a community collaboration, which is wonderful. So in addition to that, we try to prevent homelessness. So we have twice a week year-round where we use mainly local funding to do eviction prevention, a security deposit. So even when you get into housing, you have to have a traditional security deposit. So we help with that, IDs, birth certificates. Kids can't start school without an ID, and you need everything to get your ID to get employment, housing, or crucial services. So utility shut off, things like that. We have our financial literacy program, which is to help people learn a budget, right? Regardless of your income, regardless, if you don't have a budget, you're not gonna have enough money. But also learn, we now see that poverty is generational. So you have to learn to make a budget. My girls have a mom in finance. So an example I used for many years, if we go to McDonald's after school, I was hungry, I'd pick them up. At the end of the week, that was $100. They're in college now. That was a while ago, right? So I said, okay, at the end of a week, that's $100. That's half of a plane ticket to go see grandma. I'm from California, which means Disney. We can either go to McDonald's every day, right? Or we can go to Disney in the summer. An example our former financial literacy success coach used was, it was $10 again, inflation. You get $10, you go to the convenience store, you leave with one meal. You go to the grocery store, again, it's probably closer to 15 to 20 now. You get a loaf of bread, peanut butter, lunch meat, a bag of apples or oranges, you have lunch for the week. These are skills that have to be taught. And these are skills that are crucial for the strength of our community. So that's why we teach financial literacy. And then, of course, our Bridge to Change program. So our Bridge to Change program was started in 2019 with Councilwoman McIntyre and the former director both saw the video in Fort Worth at the same time. And so what we do is CHIP goes alongside to mentor and work alongside clients that have been cleared by case management that are ready for change to pick up trash within the city of Hagerstown. However, they're also learning those soft skills. You have to show up to work. You can't have your picker in your bag in one hand. Can't leave in the middle of the shift with your girlfriend. You can't buy alcohol in your uniform. All real examples. And what they learn is those soft skills, confidence, and build up a stamina. If you haven't been doing anything, how do you just start working 8 hours? And so that program, it's wonderful because the city benefits, but it's truly for those to gain that independence to go on to workforce development, employment, and hopefully get housed. The crucial piece for all of this is our case management. And that's why I asked Jill, she actually helped create the case management program in 2010. Homelessness is complicated. There's not one way in or one way out. The services a single mom needs is different than what an elderly individual with a background versus a veteran. So their individualized case management is that crucial piece to connect what is it that you need to resolve your homelessness. So I thought I'd share part of my 15 minutes so Jill can share her magic.
Hi, I'm Jill. I'm the Director of Housing and Case Management. I've been at REACH since 2005. Originally started strictly working in the shelter, and at that point we were basically just housing people, but there was definitely a need to help them move on, and so we created our case management program. Right now we have myself and one other case manager, so we work with the folks that stay in our shelter.
Put your microphone up closer. There you go, just make sure.
So we work with the folks that stay in our cold weather shelter, but we also work with individuals in the community. So we work with the folks that are staying at the Union Rescue Mission, when the Salvation Army was open, St. John's Family Shelter, anybody on the street. So we can take referrals from anybody that's homeless. So we're not just working with our shelter residents. So we do an assessment with them. We find out what it is that they're looking to get help with. Some people, it's not housing. They're not ready for housing. So we work on some of those small steps to get them hopefully closer to that housing piece. Right before this meeting, I was actually, we have case conferencing call every 2 weeks with the other providers. So that's REACH, CAC, Horizon Goodwill, Potomac Case Management, CASA. So we're all working together in collaboration to talk about, in this particular meeting, specific clients, maybe some of those hard to place, maybe a little bit resistant to services. We collaborate and talk about those to see how we can work together to help that person. We have providers that come into our shelter to provide outreach. We have a handful of veterans that come into our shelter each year, so we work pretty closely with the Martinsburg VA to provide services to them. We work closely with Potomac Case Management. Their outreach services come into our shelter every week. So we try to collaborate as much as possible. Horizon Goodwill has come into our shelter. And then through our day program, we get people that just walk in, whether they need to use the bathroom, they're getting their mail, and they can be referred to us as well. I think the key piece of what we do is not everybody's gonna be ready when they meet with us. And we try to make that connection with them. If they're not ready right now, we stay in touch with them and try to eventually work towards those goals. Sometimes it takes a couple of weeks, sometimes it takes a couple of years. We have clients that have been there since I've been there, and we're gonna continue to try to work with them regardless of how long that they've been there. So it's definitely gotten more challenging over the years, but we keep doing what we're doing and try to make a difference. You know, I think one of the frustrating things is, I don't think any of us got into this position because we don't want to make a difference. We wouldn't stay in this position if we didn't want to make a difference, and that's what we're trying to do every single day.
My turn. Good afternoon, everybody. My name is Teresa Searcy. I am the Chief Client Officer at Community Action Council. I have been there since April 2021, so right in the middle of the pandemic. So came in at kind of a different climate, I think, in the community. Just learning what our new normal was. And so the CAC, and just a really brief history, there's 1,100 across the nation. There are 17 in the state of Maryland. We do receive a community services block grant to do what we do. It's how we exist. The main services, and really each community action is different because you really look at the needs of the community and determine what services we should offer to be able to make a difference in the community. So at Community Action, we offer, of course, the housing assistance. We do work closely with a lot of our community partners, again, with just the same, walking that path with them to help them, whatever that next step is. So housing is eviction prevention. It is helping the homeless, either in shelters or on the street. We offer energy assistance, which is an entitlement program through the state of Maryland. Lots of changes this year, which we can discuss if you'd like. Food pantry, which we've seen a huge increase over the last several, not just years, but months. Months have been really increasing. And then we have a Circles program, which is our poverty alleviation is the idea. There's a two-pronged approach there. You are working closely with families and individuals for 18 months. On the other side, you are working to look at policy and things that are in place that are kind of keeping these households from surviving, whatever it might be, to push them forward to become self-sustaining. And then lastly, we have our mobile services, which that was a pilot program about 2 years ago, has really taken off and taken hold, not only in the city of Hagerstown, but the county in general. We've gotten out to a lot of different places throughout the county to give services to those who are not able to get into the city and get into our office, but we take those services on the road. So we've actually set up some satellite pantries throughout the county, helping those around who, again, can't get in or have transportation. And lastly, we have transportation. And if you've seen our cat buses, I'm sure, across the city, they provide workforce transportation to Hopewell area. And we also have non-emergency transportation. So if individuals need to get to appointments within Washington County, we can pick them up and take them there free of charge. So those are the 5 pillars of our service at CAC.
Thank you.
Wonderful. All right, hi. I'm Melissa Dash with Sheppard Pratt, but I'm going to give our history, which involves many name changes. So we were known as Turning Point many moons ago, and then merged with a company or an organization called Waste Station Incorporated, and both names are now dead. We are Sheppard Pratt. But the same services still exist, and the same staff, many of the same staff still exist. So we are the only residential psychiatric rehab provider in the country, or I'm sorry, in the county. I did the same thing. They, that basically is clients who are referred through the core service agency of Washington County to us, and that actually is, state-led. So many of those referrals are actually coming from state hospitals in the state of Maryland through the core service agency. They determine which one is the highest priority and then is released to us based on our bed vacancies. We have 41 current beds in the county at varying levels of intensity. So 24/7 staffing, 40 hours a week staffing is the next lowest or next level down. And then our general level staffing essentially is an 8-hour shift of availability to those clients, but not necessarily constant supervision of any sort. And to be clear, the 24/7 staffing, it's not lockdown, it's not, there's no curfew, there's no expectations around those kind of boundaries. They can come and go as they please. They are urged to take medications and participate in services. If they don't, usually bad things happen and then we have to discharge, but it's not necessarily a requirement, to be clear. We also offer supported living. So we have some apartments in the community that we can offer to certain clients if they really kind of meet the qualifications of that apartment, and then we rent it to them as a leaser, as a landlord. But then we also in turn provide in-home services to those individuals. We'll also provide services to someone at their family's home, or if they're homeless, help them with their services. Or they could also be living very independently on their own, but just need a little extra support. So that might look like assistance with grocery shopping, doctor's appointments, budgeting, a lot of the same things that kind of we're talking about, just on a more one-to-one kind of level with the staff assigned to them. We offer community employment services. We work very closely with DOORS for those services. We have a sort of community treatment team. It's a fidelity-based model, like a mobile treatment, but not mobile crisis. So we have a team, there's a prescriber, there's nurses, there's a therapist, there's a housing coordinator, there's a job coordinator. They work together to serve generally the most intense clients, somebody who cannot consistently attend their psychiatric appointments, their doctor's appointments. They are habitually incarcerated or hospitalized or homeless. And so those are services ideal for those folks. We also have substance abuse and clinic services, a prescriber, and a variety of therapists that is open to Washington County residents, and we are actively enrolling. We have a day program for any of the clients that are in those other support programs. For the most part, are welcome to come into our day program or can be referred just for that program alone. And then we have our mobile crisis services, which is grant funded currently. Hopefully we'll be transitioning to a fee-for-service model in the future. And they are open to the entire Washington County population. They do go all over the county to see people. We can respond via phone. We can respond in person. We have MOUs with the school system to go into the school during crisis situations as well and support there. And they are a variety of either specialists or licensed individuals who are helping to work specifically with, and that's the grant's expectation, is to work with law enforcement. So we have access to radios for both the Sheriff's Office and HPD to be able to hear when there's some sort of mental health disturbance, and we can dispatch ourselves to that scene and work with law enforcement to be able to prioritize what are the needs of this individual and what's the situation going on. They also work closely with the health department around substance use and harm reduction, so that we are really partnering at all times and getting these people into the services that they need most. The idea is to avoid hospitalization and to avoid an EP, because ultimately, if we can help them to stay in place, that's actually probably more beneficial in the long run than them going to the hospital only to end up in the ED for 4 hours and then get turned around and said, you don't need us. And then it's just a frustration on everybody's part. And then I think that pretty much covers it. There is a small program that's working in some of the schools in Hagerstown, specifically that is doing some therapy and some support as well. It's a kind of a smaller grant-funded program as well.
Thank you.
All right. Dave Schuster, President and CEO of Horizon Goodwill Industries. I have to apologize up front for my slightly raspy and angry sounding voice. I am not angry. I'm at the tail end of a respiratory thing, so I'm just a little hoarse at this point, so I apologize for that. So just bear with me. I did distribute some information. Hopefully you all got it to the council ahead of time, thinking I could save everybody some time. But I want to just touch on a couple points because there's a lot of different programs that we've embarked upon. But at a high level, all Goodwills, we're one of 154 that are in this country, are workforce development organizations primarily, founded on the belief that helping people acquire skills and to be gainfully employed is a critical piece of the pathway out of poverty, out of subsidy reliance, out of all of those things. That was the founding of the movement. what we started to realize here locally, actually pre-pandemic in 2019, but particularly exacerbated by the pandemic locally, is that what if having a job isn't enough? Or what if there are confounding barriers and factors that we might be able to help you get a job, but you can't keep that job? For instance, being, as others here will tell you, being homeless, it's a little difficult to show up to work reliably every day if you don't have a secure place to go home to at night. So we started realizing that it is great that we can continue to do the things that we've been doing historically, helping people with working on their resumes and getting job skills and connecting credentials at the community college, whatever the case may be. But if we weren't also working with folks to help address those other things, then what's the point? To be perfectly honest. And so that's why you will see what to some people's eyes may sound like a duplication of services when you look at the list of things that we're doing, because there's a lot of things that my colleagues here have shared already that they also do. But one of the things that we have started doing in concert with our Goodwill colleagues across the country is looking at different models that really endeavor to put the person first and try to figure out what are the barriers to people actually accessing the services and how can we help them. And so what we've noticed, particularly with any population, I think everybody will agree, and one of the individuals that was at the public safety meeting last night actually said this really well. It was a good key point, I thought, was that you have to really understand where someone's from in order to help them successfully, because otherwise you're going to fail. And so that is sort of the model that we've shifted to. That's why I wanted to provide that sort of background information, because we then are able to figure out whether it's a program that we now are operating that may be a little bit different and better suited to a person than one that's been in existence in the community for a long time, or whether it's one of those community programs that we can refer somebody to, how that might work. Because I think we all know not everybody comes to Reach's door first, not everybody comes to the CAC's door first, not everybody comes to Goodwill's door first, right? You go typically where you may feel most comfortable, particularly when you need support and assistance. So it's not necessarily a bad thing, in our opinion, for multiple organizations to be running similar programs that may operate slightly differently, as long as they're all still running in some level of coordinated fashion, which I believe you've already heard from others here is what I think as a community we endeavor to do. So that was really, unless you have any specific questions about the materials, I wasn't going to read through every single program that we do for the interest of time, and wanting to be able to, I think, participate in a conversation instead of me running through a list of 20 things.
Council, how do you guys want to do this? You want to ask us questions to specific, or do you guys want to? How about you just take it away?
Okay, I'll start. One, thank you for joining, especially busy schedule, so we really appreciate it. So one question we've been asking stakeholders and organizers and entities that are coming here to provide educational background is, what can the city do for you guys? Okay. And chime away.
All right. Do you just want to go clockwise rational?
I
or?
think it's just popcorn style.
Great.
That's a mediation term, like pop in.
One thing that you could do that isn't necessarily to give, but to help us educate people. There are 6 shelters. So I brought the guides. I left all my HARC food bank lists that our friends at HARC give out, where it's every clothing bank, food bank, and soup kitchen across the county. Where when money is tight, where can people go? You don't need a food bank card anymore, and that can help. In addition to that is the street guide. And because if people realize, okay, this is what's going on, what are we missing? Something we've learned through our coordinated effort with the local homeless coalition temporary shelter while the Salvation Army is closed, there is a dramatic increase in single fathers. So other than St. John's Family Shelter, there isn't an option for them outside of this. So that's kind of exciting that if and when the Salvation Army reopens, maybe we can look at that's a need. But there are 6 shelters here. They're all a little bit different. We have a robust continuum of care. I'm very proud of it. DHCD uses Washington County as an example because our coordinated entry efforts started just as Jody was leaving Reach, so 8 years ago. We've worked out kinks. We can always get better and do more. But people need to know there are 6 shelters. Are there enough? No, there's never enough resources. We collaborate, as Jill shared. There are drop-in centers. There are places people can choose to go during the day. People can shower every day. Men can shower at the Mission. I think it's 10 to 4. They only close during mealtime. Reach is spaced during the non-shelter season. The homeless can shower and do laundry. There's somewhere you can go every day and get a hot meal, sometimes twice. There's a variety. It's so complicated, and that's why there's so much on here. It's a snapshot. But just helping get that out so they hear, I mean, look at the wonderful, it's not every, we have more to do, but look at this strong collaboration. So know this is what we have, and then what do we need to do from there?
So when you say help educate, how do you, like, could you give us, this is important, right? Because give us some actual things. Like, do you see that in council closing comments? Do you see it in our social media? Like, how, because you deal with the population every single day. You guys are the experts in your field. So how do you see us from our elected seats helping educate?
So I think this is a fantastic opportunity right now. We were so honored. I don't know if you can have these on our website. Most of us have them on our website because they're updated, they're dated. The HARC list and this, but I think having us here and maybe routinely bringing something up. One thing I would love, I know it's probably not the season, how cool would it be to have all of you come and serve dinner one night? You don't have to buy the food, like you can use the stuff that we have in the kitchen or freezer. I would love that. Or what if you guys came and the delegates came? In the same night, you can have 10 people in the kitchen. It doesn't have to just be in the kitchen. I think that would be fantastic.
I agree. I enjoy it when I volunteer with the
Yeah.
church during Christmas time.
Yeah.
So,
Yeah, oh yeah.
The guide that you have together, the street guide here, it's fantastic. I grabbed one last night at the public safety meeting. These, where can folks get these? Like, I would like to encourage folks to, what's the term, to give smarter, right? To give in a more wise manner.
And that's one thing too, and that's a whole nother segment, and don't let me hog it, I don't wanna be. But, you know, we created together, Chief, Brooke, Cindy, when she was with, still Turning Point, it's like your friends that get married, the maiden name.
I know.
They created the Change the Way You Give. You can give $5, right? They're not gonna stand there and starve. So by not giving that way, you change the way you give, you drive them to encourage them to get to the soup kitchens, where outreach goes, get into the shelters. So these are on Reach's website under resources, HARC's website, CAC. I believe emergency management, if you can have them on your website. We post them on the Homeless Coalition base camp. I'm happy to forward things. I forward things to Cody, wherever. But both of those guides live on all those websites under resources.
So, do you know if that's something that we can put on our website?
That's
I'm
Wes.
sorry.
Hey, okay. All right, so I'll email it to you. Wonderful.
CA.
At one point, Tom, we used to have a guide out there, so maybe during an upgrade. Okay, yeah, but if it's not, it will be.
You can probably stay.
Yeah.
Well, we got smart. There's a couple of things came out of 2020. We got smart and started putting the date on the top. Because so much changed in the spring to the fall and beyond. So they're dated, HARC and the street guide.
I want to make sure that everyone got an opportunity to answer Councilwoman's,
Yes.
how could we help each agency?
I will kind of hop on your coattails a little bit,
Thank you.
mentioning, I'm not sure if you all are aware of the local homeless, I'm sure you're aware of the local homeless coalition that we meet quarterly. I had a talk with Jeannie the other day, is that out of those meetings, it is such a huge lift to get everyone to the table, but those meetings tend to be very well attended by many community partners. And they're one supporter. What I'm thinking that needs to come out of those are action items. What are our top priorities and how can we tackle them? And can the council maybe give us a list of some of the things that you're seeing that are, more, maybe some of the bigger complaints that you're getting? So we can turn some of these into either working meetings or something that we have coming out of those meetings that all community partners or most community partners are at the table. And of course, the tack onto that, funding is always good.
Oh, yeah. No, I like that too.
Don't turn down
Because,
money.
yeah, right. Because the challenge this year has been the closing of the Salvation Army shelter. And it was a great collaborative effort through the local homeless coalition to get the shelter open. It's been open since April, is it April? But funding's only gonna run out in January, which is the middle of the cold months. And so that is currently 5 occupied rooms of households that will have nowhere else to go because there are limited beds in this county for shelter. But the local homeless coalition has just been a great way to get information out to community partners about each other, but putting some action behind everyone coming to the table and what can we actually start to tackle, or even continue to tackle as we see issues change, and you know, the landscape of what's happening in our county change. Like I mentioned, the food pantry, we are giving out 1,000 bags of food a month, and that's a huge increase from 2-3 years ago where we were giving out 300 a month, just showing how much need there is. And so, you know, it's a large tsunami of need out there, and so how do we start to chip away at that and really put some action into what's happening?
Thank you.
When was the last time the resource guide was updated? You guys know?
Say that again.
So there's a resource guide. It's not as fun and easy to hand out as this. It's a booklet, but it, yeah, do you know?
2019.
It was.
Yeah,
We
I was
just
gonna say
talked
it's been a
about
minute,
that.
yeah.
We need a committee.
So we need some people to support doing that because there's a lot of resources that have clearly changed since then, dropped and added. And so I think while it's not as ideal to hand out, it's still an excellent resource. And I think we could probably get maybe a little smarter about how it's accessed, and so it can be more online and accessible that way. But I think really promoting where are the resources, not just, you know, soup kitchens and shelter, but also, you know, to get a provider, you know, how do you get somebody to prescribe you medication if that's something that you need, or how do you, you know, get into substance use treatment, or, you know, whatever the case may be. So really making sure that people know where those resources are and who can help them for different things, because I function from a slightly different place. We sometimes get homeless people, but or people in need, but we are dealing with them, getting them into services, and then we're going to need a prescriber to give them that, you know, diagnosis, and then we got it, you know, and so we're coming from a slightly different place. We can always take referrals though, right? So we want folks to come in so that we can get them established in services, and then hopefully avoid some of those other components that are a struggle in the community. So.
Can I jump back in really quick? I'm
Yeah,
sorry,
she
Dave.
said popcorn.
One thing that did come up in that meeting was 211. Maryland 211 is great for resources, but there's not an easy way to just, I guess you have to call. We threw out an idea of an app. Could there be an app for Hagerstown, Washington County? You just click on the app and find out what resources to go and what do you need to be eligible for the services that you're seeking. And so that was another idea that was thrown out.
Yeah, because it does get confusing. Yeah.
Yes.
Yeah.
So I'm going to take a slightly different approach. You know, I think nonprofits and you all as government are often held accountable for solving a wide variety of issues, and people wonder why we aren't able to make progress on those things, despite all of these efforts to support individuals. And one of the things that I think I have learned is that we can provide individual supports to folks and help them get so far, and that so far is until they hit the system, which was also brought up last night in the meeting last night, that in some large respect, many of the forces that have folks stuck in some of the cycles they're in are systemic, and they're not necessarily things that without a little bit of bravery and going out on a limb and taking some risks to figure out what are the systemic challenges here and what power, especially as elected officials, do you all have to change those in various cases. We will be somewhat moderately successful, but we will still be coming back here, you know, pounding our heads on the desk, saying what's going on here. You know, there are examples. I won't waste everybody's time going into, but there's some examples about some of the economic conditions here in Hagerstown, Washington County that are systemically related, that ultimately end up having folks encounter a lot of the challenges that we have right now. I think one of the biggest things we should look at also collectively is how hard it actually is to get out of some of the circumstances we're talking about. You know, as I was driving here from Smithsburg today, I was reflecting on the fact that I can get my car and drive anywhere I want to at any point in time during the day. I can go to the doctor's office, I can go to the McDonald's, I can do whatever I want to. right? I have that because of privilege and because of a lot of different things. But many of the folks that we're helping, they do not have that, and instead they're beholden to our schedules, our rules, our timelines, our funding, and our things, and we wonder why they seem to have a different experience than we do, right? And why this is so hard for folks to seemingly want to get out of the position that they're in. Well, part of it is because the rules oftentimes in the systems often make it impossible to do that. So I think that would be the other piece that we should really continue to look at. And while I think we've made progress here, I think there's still a long way to go about how we might be able to streamline those things and recognize that, among other things, just as an example, having to rely on public transit for all of your transportation needs is a little counter to the example I just said. I can get in my car and go whatever time I want to, right? The two things don't necessarily add up, so we wonder why it's so much harder, or it seems to be so much harder.
Thank you.
I agree, and I agree in so many ways. You can have all of the services, you can have all of the things, you can have great people working there, but when people meet that thing, whatever it is, whether it's support, whether it's transportation, whatever it is, then they end up back into the same situation. And so I do agree. I think that for me, I think that conflict resolution has to be a part of different agencies. And the reason why is because if someone comes in and they have an issue, it's just like with church or with your houses of faith. If they have an issue with you, now it's Reach has done this. Reach won't allow, if there's someone that has an issue with police, it's the same within the government side, then it's the police won't versus that one specific personality issue. If someone doesn't like me, I'm not doing conflict resolution or the city, right? Matt upset someone, council member, Schindler upset someone. Now it's the city is against me. And so I agree that the systematic things are in place, but then I also believe that conflict resolution and being able to help folks be able to understand how to address their individual conflicts, and then also agencies having that in place. Because if I have an issue with Teresa and I can't get beyond Teresa, now my issue is not with all of the services. My issue is with whoever oversees me being able to get my conflict done with, taken care of with Teresa. And I won't feel, and I know this because it's a family thing, and my mom won't mind me sharing this, right? But I know she won't. But my mom may have had personal issues with specific people that kept her in a cycle of shame, of guilt, of not walking into a place because she went to high school with someone and they treated her wrong. And I believe that that is one of the biggest things that we have here in Washington County. If I know you, you know me, those types of things. So I just wanted to throw that out there from my mediator brain outside of the
I
mayor.
like that. One thing too, it could be a different day. In 2020, right before the 2020 that we all think of, there was an initiative to look at the tax sale that was beyond the value of the property and perhaps foregoing the taxes. I'm probably doing a poor job explaining this. So is that something that we can revisit that could help maybe Habitat for Humanity or CAC or the different agencies that do housing?
Well, that's actually
Sounds about
next
In
on our
about,
agenda.
in about half an hour.
It's next.
However that works, okay, great, so I didn't, okay, yeah, I feel like
So you
that's
solved
not
that,
necessarily
you
us.
solved that telepathically.
There you go.
That's my
Yeah.
mom intuition, but that was an exciting, and then of course, we tried to do it by Zoom a couple times, but I
Yep.
feel like that could be, it's not one answer, it's not one size fits all.
Stick around, it's right after you,
All right.
so stick around.
Did everybody get a turn to ask? Do you feel like we answered your question?
Oh, yes.
I get off
Thank
on
you so much.
tangents.
Thank you.
Great.
Can I ask?
So,
Do what you want.
Did either of you have something?
oh, yeah.
Oh,
Go
look, he's
ahead.
like,
Yeah, then you
have
got
at it.
Okay. First, also, thank you for being here. Thank you for helping not only those of us here at the table, but everybody watching at home, streaming, whatever they're doing, to understand more of what you do, which I think is very important. I'm going to be a little bit more direct because of why you're here. You're here because Senator Corderman sent a letter to this mayor and council in late July. And I'm going to quote two sections from his letter. These are Senator Corderman's words. Quote, and I should say, he's telling the mayor and council what we should do. Okay, just keep that in mind. Quote, end enabling and exacerbating the plethora of social services continuing to expand in the core of the city. And then he goes on to say, simply put, change zoning in the core of the city to focus on positive business development. In other words, and that's an end quote, in other words, in my opinion, he's saying, let's just get rid of everybody that appears to be a problem. Another section, section 7, he says, quote, reevaluate the city's financial support to nonprofit organizations, that's you, whose business model thrives on the continued degradation of our community. There are areas of our city that have become overrun by individuals who clearly have no desire to better themselves or contribute positively to our society. Yet these nonprofits continue to cater and attract this very element that is creating disorder throughout the community, end quote. These are the words of our state senator to the mayor and council. Now, the particular issue with that point, that second point, was he's implying that all of you are fully funded by the city of Hagerstown, which we all know, and I think anybody that doesn't live under a rock understands that that is not the case. I know that there is some funding, and correct me if I'm wrong on this, but for example, with REACH, I know the program that you mentioned, the Bridge to Change program, is partially funded by the city because it's a creature of the city. It was created by concept that came out of the council to, last administration. I know that there are pass-through grant opportunities that the city facilitates. For example, CDBG money that are federal funds, but pass through the city because that's the way it's structured to your organizations and others and so forth. So it's definitely a false premise for the senator to be implying that, first of all, that you all and every other nonprofit is fully funded by the city of Hagerstown and that the mayor and council should knock it off. And secondly, it's inappropriate, in my opinion, and I'm assuming in yours, that it's implied here that if you all just went away, so would all of the other problems. So that's why you're here, okay? It's important for folks to understand the work that you're doing and why you're doing it. Because clearly there are people, including the senator, who do not understand that. That do not understand the ramifications of taking an entire population and ignoring them. Okay? And look, I know that nothing's perfect. There are no programs that are perfect. There are no solutions that are perfect. It's I think it was mentioned, it's an ongoing challenge. The populations are different. There are, as again, someone mentioned, you have to meet people where they are. Almost each individual, right? And to say that basically the nonprofit and social services organizations, not only in Hagerstown and not only in Washington County, not only in Maryland, but across this nation, are contributing to the problem is foolish, in my opinion. I think that it would be inherent upon us, and I really appreciated Councilwoman Burnett's first question, which is, I think, indicative of the way that this mayor and council, and I don't want to speak for everybody, but from my perspective, the way this mayor and council looks at all of these issues. How can we help? What can we do? Okay, and that's important. And it's limited, you know. We have limited resources, we have limited opportunities, but there are things that we can do. I would also point back to the senator and say, Senator, what are you doing to help? This letter does not help. The meeting that was held that Mr. Schuster referred to last night did not help. There was not one tangible solution that I heard standing there for 2.5 hours that came from any of the speakers. Some of the speakers were very complimentary of the programs that are happening. One of the first speakers was a gentleman that's in recovery and trying to get his life back on track. There were speakers, people who live in the city and spoke well of the city of Hagerstown. There were people who work for the city and stood up and said, hey, you're wrong, okay? But the plethora, using this the senator's term, the plethora of comments were, here are all the problems, period. I'm gonna get up and walk away now. Not any solutions. So we're looking for solutions. As you may know, because of the context of this letter, we've had, sitting in the seats where you're sitting, the Washington County Health Department to describe and articulate the programs that they have. We've had the state's attorney. We had the chief judge of the circuit court. We've had all of the levels of law enforcement that the citizens of Hagerstown have, including Hagerstown Police Department, the Washington County Sheriff's Department, because yes, we are in Washington County, we are residents of Washington County, and the Maryland State Police. We've had these different groups and these different individuals come and speak for the same reason that you're here. Because it was implied in this letter, maybe even more than implied in this letter, that this mayor and council are the reason that anybody has any problem. And I take offense to that. And I was hoping that last night's meeting, which was entitled Potential Solutions, and when I started taking my notes, I titled my notes Solutions and underlined it. And at the end of the night, my pad was still empty. So I appreciate the fact that you're here bringing potential solutions and real solutions to this community, for the people of this community. And I appreciate Councilwoman Burnett's approach to how can we help. So that's what I had to say.
Thank you.
Thank you.
I think that's amazing, that you wrapped all of that up into that, because that is the absolute reason why you're here. And we do say, you know, he wrote the letter, but at the end of the day, that's why I ask for more, like, give us more. When you say help educate, what does that look like for this elected body, right? And that's why I asked that specific thing, because if we don't walk away with some action items of how we help educate, then my way of educating is doing it the same way that I do it, right? But you haven't given me something that I could come and do. And so that's why I wanted it to be kind of specific, because it looks different. All of us we're elected. We all work, different. We're the elected body, appointed, some of us appointed, whatever. But, because that's important. I don't want anybody to say, she's not elected, she's appointed. It's important that we know how we could help in our roles outside of being part of the elected body, but what does it look like as the elected body? What could we do to help along with the staff that we have? And so thank you for that, council member, because that is important. We can talk solutions all day and not give anyone actual action items. And when you come up with a plan, that's the thing that we go through. Okay, who's gonna do that? And how is that gonna get done? right? Okay, you want council to help educate, okay, who's gonna do it? How's it gonna get done and what does it look like? So thank you for that pinpoint.
Can I make a comment to the point that was raised there?
Absolutely.
Hopefully on behalf of my colleagues. So one of the things that concerned me about that is the somewhat myopic generalization of all nonprofits into one category, right? Because the reality is, then that's great, the Humane Society is also contributing to this problem somehow, right? So that's the first thing is we have to be very careful about that. This actually comes to a solution, believe it or not, in 1 second when I get there. But I would imagine everybody else probably had similar concerns when we read that. We're like, who are you even talking about, right? Now, where I think that comes from, and listening to the conversation last night, which I had to listen to over my morning coffee today because I couldn't be there last night. It's interesting to me what we often want to do is oversimplify the issue to one key point, right? Jeannie made the point earlier that homelessness is complicated, and that's absolutely true, right? For every person who's homeless, there's a set of circumstances that got them there, and for every single person, those are different, right? But we tend in meetings like that and in places where we have the mic especially to want to oversimplify the issue into something that we can say. So that's one of those pieces that I would suggest everybody needs to be very careful about. And one of the things that I think we run into a lot with that is some examples that folks use, right? And I did hear an undercurrent of this last night, so I'm gonna lift it up as a thing that I think we can all work towards being better at. And it is that, for every person who was able to overcome adversity, overcome addiction, overcome whatever, and stand up in front of a room and demonstrate that they are now, that they are now in recovery, they're a contributing member of society, that immediately propagates the belief, well, if they could do it, everybody ought to be able to do that, right? Just like for every person that you see on the street still that doesn't do that looks like that they're currently actively using and that they're in, they're unhoused and they're experiencing these circumstances, the natural indication is to say, well, they don't want help, they'll never be helpful, they'll never be helpable, right? So we tend to want to categorize folks into these groups when honestly, I don't think anybody would agree that that's ever true, but it is a very big risk, particularly from a leadership standpoint that we run. And so I just wanted to, that's what that kind of stuck in my mind as Councilman Perini was speaking, that's a big concern in listening to language like that anywhere. And so from a solution standpoint, I think we need to continue to be mindful and careful about how we try to categorize people and how we have these conversations.
Appreciate that, thank you. Yes, language is important.
Well, I've known, I have family and friends that have visited each and every single one of your agencies, and they have spoken highly of you guys. And for me, I am grateful for your services you provide, because without it, I just can't even imagine what that would look like. And you guys do the work every single day. So I appreciate, again, you guys coming to provide more insight on what that is that you do, because a lot of people just don't know and think that we don't have that. Well, we have 6 shelters, but they think we only have 1 or none. Some people said none, or YMCA better be a shelter, but whatever. It's another conversation. So again, just thank you.
So I had a couple of things. First, thank you guys all for being here. It's extremely, extremely helpful. And like you said, the awareness, getting that awareness out, this is what we're kind of here for, in my opinion. I mean, we do what we do, and you guys do what you do. We don't do the same thing. One thing that I've been hearing recently that frustrates me is I've heard multiple people use the term or something along the ways of fixing addiction and fixing homelessness. And you can't fix those things. And I think everyone here would agree with that. We can treat it, we can work towards prevention, we can help, but you can't fix an addiction, you can't fix homelessness. So I appreciate you guys, and we can't fix it. There's never not going to be a need for the services that you guys provide. So thank you for that. The one thing I do hear a lot, and it's insinuated in the senator's letter, is that the amount of services that we have in the city of Hagerstown are attracting folks that need services, like a moth to the flame type of an idea. And I'd be curious of your thoughts on that, because we hear it a lot. Well, Hagerstown has so many services, people come to Hagerstown to get services. That's a big misconception out there, I think. But I'd like to hear it from the experts, because I don't feel that way. But I'd be curious if any of you have thoughts on that. Because
I have one quick thing to say.
Absolutely.
It's very small because we have, ours is a little more closed door at times, but I am not allowed to increase or create new programs without proving that the need is there first. And I have to do all of my research and all of my data collection before I can even propose the idea of increasing or creating a new service within my organization. And that is months or even years of data to prove that I can support financially creating that service. So, if that helps.
that does.
That does help, because what you just said was, I have to, the need has to
Right, the
be
need
there
has to be
before the
there
money's
first,
there.
before I
so-
can do anything about it,
And
yes.
this is what we hear, that we should be making data-based decisions,
Yes.
and that's exactly what
Yes.
you're doing. So,
Yeah.
Are you
thank you.
gonna say something, Jill?
No, I was just gonna say, the majority of the people that come through our shelter have lived in this area. They've
Thank
lost their job, they've lost that resources from their family because of their addiction. If they are not from here or they have family elsewhere, we try to help them get back there. Like, if you have family somewhere that's willing to help you out and take you back, let's get you back there. Like, our goal is not to keep you somewhere where you don't have resources or you're not gonna get the help. We seek to get them back to where they're gonna do the best.
Would you guys pay for that? Or do you have resources that you kind of tap into in order to do that? So you have someone that has support somewhere, or do you help facilitate
We
that
can
at
help
any time?
facilitate that,
Okay.
depending on the funding, and we can work things out. It doesn't always work, but sometimes it does.
Thank you.
And then, I'm sorry.
No, I was
I'm
just-
sorry.
So, two observations. Number one, I didn't know you were gonna ask this question, so I didn't bring the data, but there are any number of national level studies that debunk the myth, particularly that homelessness is transient, right? Majority of individuals, as you just said, who are homeless in a given community are from that community originally. They do not move across the country to where things look better. You know, that's not how it works. I suspect this again may be one of those, we heard about this one person that one time, and so that sticks, right? A corollary to this that I know, and I'm not as well versed in this, but I believe I have this correct, is, you know, we do have several state correctional institutions in our county as well. And I believe there's also some presumption that there are individuals who were sent there from other parts of the state who theoretically are being released here, right, and are now becoming part of our problem for various reasons. And while there is some small truth to that, it is not nearly to the numbers that folks assert, because the reality is everybody has to have a home plan pre-release, right? So they have a plan with their pre-release caseworker about where they're gonna go, what supports they're supposed to have, and how that's all gonna work. It can be possible that plan is to be released to an agency or program that is here in Washington County. I'm not gonna deny that, but again, most folks go back to what they know and where they were from originally. They don't decide to just transplant here necessarily.
Can you
Thank you
share
for
that? Sorry, Mayor.
Go
Can you
ahead.
share that data, email the body?
I
You have
can,
it
yeah, I can
online?
track that down.
Oh,
Thank you.
Sorry.
It's okay. I was just gonna say the state prisons facilitate, the partnerships and things that come in with state agencies, help facilitate that. And that's always, I know that's some language that is constantly used. I was just in a room the other day where I said, you know, I think that they're back to releasing, everyone from the state back into Hagerstown. And again, there was I corrected it because I'm part of a team that goes in and help people make a plan about living, what their life's gonna be like. And so the state does help facilitate people to get back to their community. Now, there are some folks that are part of our community, they come here, they set up life here, but for the majority, that is the case, and that's facilitated through the state.
And I have one other thing I wanted to ask you guys about. Again, stemming from what we're trying to address and to just talk about it. And that's the idea of being geographically diverse with where we're putting our services, whether that be the county. In this instance, it's talking about downtown Hagerstown, right? Should the services be geographically located in downtown Hagerstown? What are the obstacles of having them not in downtown Hagerstown? I mean, I know, we've had mention of Sheppard Pratt with the mobile crisis unit, things like that, which is going to the different schools and going out of the area, which I understand that. But do you guys have any thoughts on that as far as, I think as Councilmember Perini said, I think the sentiment is that all services should be pushed out of the city, and, everything would be hunky-dory. But I don't know that it works that way. And I'd just be curious if you guys had any thoughts on that.
I think the number one handicap is transportation. So if you push a social service outside of the city, a majority of the clients are city-based. And therefore, because our transit doesn't go far outside of the city or at all in some cases, you would be severely handicapping those who are in need.
When you say transit, I'm sorry.
No, I'm sorry.
When you say transit, what do you mean?
Washington County commuter, yes.
So in that instance, I'm gonna try to paraphrase what I think you're saying, is that the folks would still be where they are, they just wouldn't have access to service.
That is correct.
And I think our services are unique enough that it's not like you can say, okay, this half of the table, you guys go over in the Smithsburg area. Okay, this half of the table, you guys go over there, and then we'll spread up, and then we'll be all spread out. Well, we all offer very different things. So you can't do that and then equally serve any population wherever we might be.
Thank you.
I think what you have to add to that is, there's no denying that there is need across the county, right? But the challenge with resource allocation, and I think we all would agree with this, is that it's the best use of resources to go where the need is greatest, right? It saves everybody time, trouble, and effort, and so that is typically why you end up finding that. The reality is, I shared earlier, I live in Smithsburg. Well, when the Smithsburg Police Department encounters somebody who appears to be homeless in Smithsburg, I don't know if they call anybody else, but because the chief of police out there happens to have my phone number, he calls me about it and says, hey, can somebody come out here and look? And usually because we don't provide service in Smithsburg, we refer them to somebody else who can, but because he knows me, that's sort of how that works. Because out in a community like Smithsburg, for instance, I believe to this day, I'm correct to say that there's really one nonprofit, which is Tabitha's Table, but that's it, who actually physically operates in Smithsburg on a regular basis. So, but I think you're exactly right. The folks are still gonna be here, even if the services aren't, which then creates that problem I was talking about earlier about how do you navigate, right? You all said it beautifully.
And also too, and more so for me, but some of the other organizations more like mine that provide some of the supported housing type and mobile treatment type services. Our offices might be located in a downtown area, but we go through the ends of the county, and are serving everyone all the way out in Hancock, So it's not that just because that's our home base for our staff, it's not that that's necessarily just where our clients are located.
Y'all might recall we had a ribbon cutting on a mobile resource van.
Ta-da.
Case in point, not everybody who even lives within the city can get to the resources within the city.
resources
To
can
be
get to everybody else.
absolutely clear. So,
And,
Go ahead.
I was just gonna add, so we offer crisis services, like Jeannie had mentioned, so we, help with eviction prevention, utilities, whatnot. So we try to work with the client, so if they're in Hancock or they're an elderly person living in Williamsport, we're gonna do what we can with them over the phone. So even though, we're stationed here, we're able to help people where they're at, no matter where they are in the county, at least for that type of service that we provide.
So I feel like you guys have all given me so many things I want to touch on, but I want to keep this flow going. And we need to remember free will. And what I mean by that, I'm going to use an example from today. What I mean by that is you can put someone in a house and give them food. You could put someone in permanent support, and this happens like what we're talking about. It's not stale. Like it's constant movement. 67 people. Jill and Bridget housed 67 people last fiscal year. 69 the year before. That's just us. Collectively, hundreds. Okay, there's constant movement. Someone gets in permanent supportive housing. The only rules, you can't have someone here after 10 p.m. and you can't do drugs in the building. It's not payment. It's not being mentally ill. Those are the two rules to live here. And when you have a young lady sells her key to get high and violates that rule, she's back on the street. There's a woman today that has been through every program, every permanent supportive housing. She is not young. I don't know how old she is because city miles, she's older. Been through every single program. She's in the local homeless coalition shelter. You can't bring people to stay with you. So she was evicted today because she took people to live with her. So these are low barrier housing. We like those words, right? This is low barrier. These are the only rules for you to be safe in this place, and you can't follow those rules. This past shelter season, we had 219 individuals, 18 to 76 years old. The majority of the people in the shelter this year were elderly or disabled. Why were the elderly and disabled at reach? Again, those aren't the faces you're seeing in the doorstep. Well, hoarding. That's the #1 call for adult protective services at DSS. So you're at the towers, you're in permanent housing for your age, your group, and the hoarding was so bad that you jeopardized the building and you're evicted. Another lady, she brought her granddaughter to live with her. Very sad circumstances. Your lease says to live here in this permanent housing, you can't have people live with you. She chose to do that. So when I say free will, these are real examples from this year that we've dealt with. What do you do with that? Yeah. We have about 15 to 20 individuals that we see every day doing drugs, prostitution. We hear about these same 15-ish people. Are they really homeless? Like they don't even come in to go to the bathroom or take a shower. And this is, hey, do you want to come in? Do you want to come in and take a shower? They're not interested in services. So the people we're seeing and you're seeing that are, it's very upsetting. It makes us mad too. We're constantly on the speakerphone. You need to move on. Our friends at HPD come, look, we're seeing a drug deal. They come and move them on. What do you do with that? You know, and I know we're all upset and people feel helpless, so they're pointing fingers and mad. But that's free will. Those are not people that are here for services. They're not here because of the nonprofit. So what do we do with that? And Alicia works her magic. Harm reduction tries to go, but if someone is not ready for change, I gave you an example. You put them in a house, you give them this, wraparound services. So I want us to keep that in mind. I want to give you a snapshot, and I'm going to send it because Mark Sewell for the Homeless Coalition. We have a coordinated entry, 305 people on that list by name. 51% are women. 21% are elderly. So I bring these up to you, and I think 31 was mental illness. I bring this up to you because that's not the 15 people we all see driving down Prospect that don't want services. Those aren't clients that want anything. They're not clients.
Thank you for sharing that, because I think that that's important. I think that that's an important piece of information that a lot of folks, we just, as Dave said, you know, the language, we just put everyone into the same, you know, category. And I think that that's important to know that there are some folks that they need to be accountable because they refuse to be accountable. And so when I say that, I mean, like, if you have a home and you have somewhere to go and you broke the rules or you broke the law or you did something, you have to be accountable to that decision. If you're not taking your medicine and that's how you got into this, that's accountability. Like, you have to go back through so I think that that's important too, that folks understand that it's not the same, it's not the people that we see out on the street. Some of those folks just do not want to be accountable to anything or to anyone. And when I got into this work 8 years ago, you couldn't have convinced me of that, because all I had was, you know, my tunnel vision and what I knew to be true. But after talking with people and spending so much time, gatekeepers, and in those rooms where you see the same 90 people every Saturday morning, those people want change. Those people want the services. They want to be accountable. They want to get, you know, active and involved in their life back. And then you run into some folks that, you know, they have every excuse. There's nothing here. There's no, have you been to Goodwill? No. Have you been to, no. Have you, so yeah, that's an important piece of information. Thank you for that.
And I think at a time where we all feel helpless, it's frustrating. I mean, I'm grateful I have it, but it's very frustrating. But I think it's important for all of us to remember that some of it is out of our control. Are there things we can do? Yes, be safe, do this. My team, if they get there and they don't feel safe to go in the building, they call HPD. We got guidance on that. There's things we can do, but there's things that are out of our control.
Yeah.
So I just think that's important for all of us to remember. Yeah.
Anybody else? Questions? Any more questions?
Can I ask
Okay.
one? There was a comment made last night related to immigration, that the influx of illegal immigrants are taking up an inordinate number of the services that are available and taking away housing from non-immigrants that would otherwise have had access to that to those services. Are you seeing in your respective organizations an increase in the immigrant population over the last 4 or 5 years? And is there any validity to that statement?
We have seen a few in our shelter. Not a lot, I would say a handful. I don't have that exact data. They're, unfortunately, if they don't have the proper documents, they're not going to get housed. So they're not gonna be taking up housing from somebody else. It's very difficult, very difficult to work with these folks, just because we sometimes don't have the capacity to be able to help them with the intense amount of assistance that they need.
Agreed. Our state and federal guidelines for the most all grants have to or do require documentation, so they have to be documented citizens.
And I've actually reached out several times this past year on the HARC to try to get them, linked with a church maybe that would be more helpful to them and have more resources than we would.
Thank you.
Oh, thank you. One more question? No? Councilmember Rainey? No?
I have something I want to say, but it can be kind of during the transition, so it's
Okay.
not directly to our panel. So I know we have like 3 minutes before.
We only have 3 minutes?
Do you guys have, I'm sorry.
Jeannie can talk.
Oh, I
Honey.
do. Well, so one thing I just want to say is when I read the letter, I did not interpret to get rid of nonprofits. I read to limit expanding additional programs. So that's how I interpreted that, so I want to say that. The other thing is, we do get CDBG for Bridge to Change. So that is personally only for REACH, the only funding we get from the city for the last 13 years, I would say. So I just want to clarify that. As far as solutions, to be fair, if I had 2 more minutes and Taisha said you should just do it anyway, but I wanted to be respectful, I do feel like they did try to ask a couple times for solutions. There's big ideas we can do. There's things we can do collectively. This is a very special community. I absolutely love it here. We're small enough, and Chief has said something like we're small enough to resolve issues. But some solutions that I wanted to share last night. Share these resources, because if people already know what's going on, then we can, what do we truly need? Volunteer your time. Right, they're doing out 1,000 bags at any of the soup kitchens. Hark's Lighthouse. Help these kids. Like I tell Addie and Artie, if their programs are successful, they're not going to need us. Volunteer whatever Humane Society, REACH, the shelter. We can't run. There's 1,200 unduplicated volunteers. Whatever you're most passionate about, share your time and energy. That's something a lot of people can do. Support the businesses and the restaurants. Yes. I love to eat out. Going out with my friends, my favorite thing. Washington County Playhouse. I do that now that we're, all of our babies have gone to college. Those are things that everybody can do, and that's small. It's not going to change everything, but those were 3 things I thought of last night that we can all do. So, because you said about solutions, I'm so excited about the tax sale thing. So that's just a couple of things I wanted to say, but yeah.
No, I agree. I mean, I think especially I agree with all of them, but especially your last point, because the more jobs we can create, the more that our folks can have a job to go and earn money and to get actual housing on their own potentially. And that's a lot of the work that we do is trying to help folks become as independent as possible and then contribute to society. So.
Yeah.
I was just got more data to that point, which I can also send this study. The number 1 predictor of homelessness is a lack of affordable housing in a community. It's not any of the other factors that you would think. It's not substance use. It's not mental health challenges. It's lack of affordable housing in the first place. corollary to that, lack of jobs that pay for the housing at the cost that it is at that point in time is a confounding factor as well. So you got two factors there that are well beyond the purview of anybody in social services to change. We are not, for the most part, economic development agencies, among other things. So that's another one of those levers to just consider how those choices play all the way down to the folks that we work with.
Thank you. Yeah, I agree. You guys have anything else? Anybody have anything else to say? Well, thank you so much for your time. Thank you for all that you do. And I definitely will be, sending a message to see what would be, I don't know if you guys are interested, but I would like to do, something, maybe we come and learn about your, the reach and then serve. So I would love to do that. So I'll send out something and with, including council and see if we can get that on there. And it may be that we could do that with all of the agencies, just come through and, be able to see how we could serve and see how we can help. And I agree with the supporting downtown businesses and all over businesses because, yeah, it's very important. And I also agree that all of us have to all support each other in all things and things. So thank you and look forward to working with you.
Thank you.
Thank you.
Next week is a 5:30 start with a work session. It will be representatives from juvenile services, social services, parole and probation, and child protective services will be here for you for next week.